So today we are telling the story of Terry. Terry is a former trawlerman and Hull used to be a really big fishing industry. Terry has a life-limiting condition and is using the services of the NHS. We're also going to tell the story of Terry's family and the various elements of the NHS Terry's family will come into contact with as well.
You will meet lots of fantastic people who do fantastic jobs in providing healthcare for everybody in the local community. I'm here to talk about Terry's journey and introduce you to Terry. We've had a 999 call to Terry's home address and he has called the ambulance service because his daughter is in labour and about to have a baby. So he's very concerned and he's very worried. He wants us to get her to hospital on time. Many people's first engagement with the NHS is through the 999 call system, and when you call for an ambulance, these are the 3 questions that you will be asked. Okay, the first question is, what is the number you're calling from? So in case you get cut off, we need to be able to call you back and get back in touch with you to find out what's going on. The second question you'll be asked is, tell us the location where you are so we can get the closest resources to you and provide the most appropriate response. The third question we'll ask is what has happened, and you can then tell the communication centre why you need an ambulance and they can give you the appropriate advice if you need to perform anything before the ambulance arrives. Now for many 999 calls, they are to a patient who is not breathing and is in cardiac arrest. So we have 8 minutes to get there, so it's absolutely crucial that you guys can perform very good resuscitation or CPR before the paramedics arrive.
Hello everybody, my name's Jason. I'm a paramedic with the Yorkshire Ambulance Service. I've been in the ambulance service 20 years now, and as Dave's mentioned to you, I'm going to be talking to you about cardiac arrest and how to perform CPR. And cardiac arrest for us is the ultimate medical emergency. We have a government target of 8 minutes to get to any life-threatening calls. So what we rely on is people such as yourselves, bystanders, to perform CPR to give the patient the best chance of survival until we arrive. What we know is that in this area about 30% of people get involved and perform CPR until the ambulance arrives, whereas in countries such as Norway it's about 73% and they have the best survival rates. So I'm going to talk to you about how to perform CPR, and we'll look at hands-only CPR. If you've got a collapsed patient, you need to make sure it's safe to approach them first. Little shake, see if you get a response. If you haven't got a response, you need to check whether they're breathing. So you put your palm of one hand on the forehead, fingers of your other under the chin, and you gently tip the head back. Okay, and then what you need to do is you need to put your ear next to the mouth and look down the chest. And you look, listen and feel for breathing. So you're looking down the chest to see if the chest goes up, listening to see if you can hear any, and feeling anything against your cheek. Are they breathing? I hope not, they're rubber mannequins. Okay, so it's cardiac arrest. You need to ring for an ambulance, make sure they're on the way, and then you need to start chest compressions. So you find the centre of the chest. Okay, so that's on the breastbone there. Put the heel of one hand on the centre of the chest, fingers of your other interlock, and then if you do chest compressions on these properly, deep enough, you'll hear the chest click. Okay, so if your hands are in the right place and you're doing it deep enough, you'll hear it click. So just have a go first, see if you can get it to click.
I'm Julia, I'm the midwife looking after this lady. This is Claire, it's her first baby. She's 37 weeks pregnant and she's coming to us in spontaneous labour. I've had a history from the midwife who was just looking after her before me. She's had quite a normal pregnancy, not too many problems. She's a bit on the larger side, she's got quite a high BMI for a lady. She's a BMI is 44, which is quite high, and she's been smoking as well during her pregnancy. So there are a couple of risk factors that we need to be aware of when she's pregnant. She's also had an infection, what we call a sexually transmitted disease called chlamydia that she had that we found at the beginning of pregnancy that we tested for when she booked a pregnancy, but she's received some treatment for that, so that's hopefully will have kept that infection at bay, but we'll also swab this baby when it's born just to make sure nothing's passed over to baby. Okay, so she's quite a long way on in her labour now. I've taken over, it's just been a change of shift, and she's getting quite a lot of feelings like she wants to push and she wants to have this baby, so I don't think we're too far off before we're going to meet this baby. This is Emily, this is Claire's birth partner, so she's come to support her through her labour because the dad of this baby is not around anymore, so she otherwise would be completely on her own, so Emily's going to come and help her. So there's just a couple of more bits of information I need to know. So you're doing all right there, Claire? How are things going?
She's not been talking much.
She's been a bit quiet, yeah? She's gone a bit into herself with the pain. Not uncommon when ladies are in pain. It can be quite scary. Okay, Claire, just have you been to see anybody about your weight and the smoking during your pregnancy?
She did go see someone. I
Did
think
she?
it was a midwife about the smoking, but she has cut down.
Yeah, she cut down.
Yeah.
Lovely. Did she go and see somebody and did they get her to blow into a machine?
Yeah.
Yeah, lovely. So they're looking at her carbon dioxide levels. Fantastic. I can see from your notes that you have cut down. So yeah, because she was smoking about 15 a day before, and you seem to cut down to about 5, which is fantastic. And I think we can keep working on that. Lovely. What about your weight? Have you been to see anybody about your weight during your pregnancy?
She's been going to Slimming World with someone from school.
Oh, has she? Oh, that's fantastic. Well done you. I can see that you've not put any weight on during your pregnancy, which is absolutely fantastic. And you've got a nicely grown baby here, so that's been really good. So hopefully we'll no further problems. Now, I know that you didn't want to be monitored continuously during the labour, which we normally would do. So I'm just going to have a quick listen to this baby and see how things are going, seeing as you're getting those urges to want to push, just to make sure that baby's happy in there at the moment. So I'm just going to have a quick listen in. And whilst I'm doing that, I'm going to feel your pulse as well, just to make sure I'm hearing baby. That's lovely. Sounds all right. It sounds like he's quite happy in there. Not being bothered by all of these contractions and this pushing. Lovely, fantastic. Right then, Claire, is that a really strong urge to want to push? Is that lots of pressure in your bottom? Yeah, let me just have a quick look and just see if I can see what's going on. Oh, right, yes, you're right. You have got a strong urge to push, haven't you? Yeah, right, well, just get you a better position. I think we're going to meet this baby soon. Okay, so I'm just going to bring your legs up so we can see. Yeah, move around if you can. All right, okay, so I'm just going to, you keep doing what you're doing. I'm just going to put some sheets down, ready for this baby. Okay, put that down there. There we go. Well done, Claire. You're doing absolutely fantastic. Right then, so if you feel the urge to push, you do what you need to do. That's it. Fantastic. Well done. Well done. That's it. Wonderful. Just little pushes. Fantastic. Oh, you're doing great. You're doing great. That's it. Can you do me another one? Fantastic. Well done. That's it. Just push when those contractions are there. That's fantastic. At the point where I'm going to get you just to pant, Claire. Okay, so when we get to the widest part, that's it. So give us a real good push. And again. And again. That's it. Well done. Another little push. That's it. Well done. And again, another little push. That's it. Well done. Well done. That's your baby's head bone. Well done. That's fantastic. So just wait for the next contraction. And we'll have this baby. I'm going to bring this baby up to you. So I'll just bring this nightie up so it can come next to your skin. Do we know what we're having?
She's having a boy.
A little boy. Lovely. Have we got a name for him?
Jack.
Jack. Okie dokie. Well, what we're going to do is bring Jack right up to you against your skin to keep him nice and warm when he's born. That's lovely. Just wait for the next contraction. Looks nice. He's pulling funny faces at us, this little boy. Lovely. Fantastic. Okay, that's another contraction. Okay, well done. Well done. Fantastic. Well done, Claire. That's great. Put that there. We'll give him a real nice dry off with this towel. I'm just going to put a little hat on him as well, just to keep him nice and warm, because they get cold really quickly. So we'll give him a nice dry off. And we'll just keep him there next to you up there. That's it. We'll keep this towel across him. Next thing we need to do is just wait for the placenta to be born. That's the afterbirth. So I'll just get everything ready. So we'll give it a couple of minutes, and then that should start to come. Okay, you might start to feel the pressure in your bottom again, but you don't need to work for this bit. I'll deliver this part of it. Okay. Do you know how we're going to feed this baby?
I think she wants to breastfeed.
She wants to breastfeed. Right, that's lovely. Well, we'll keep him there next to you then. Yeah. Let's just see if we can. Yeah, lovely. That's it. So there's the cord. Just might feel a little bit of pressure. Just as it's lengthening down. Fantastic. Just give that a couple of minutes more. Feel your tummy. Yeah, it's nicely contracted. That's lovely. Oh, he's very happy there. Okay, nice and warm next to his mummy. Oh, are you going to be Auntie Emily then?
Yes.
Yeah. Let's just see if this placenta wants to come. Oh, yeah. Start to see it coming. All right then, Claire. Okay, just feel a pressure in your bottom again. There we go. There we go. There's your placenta. You'll probably feel a lot more relief now that's out. Lovely, we'll get rid of that. So just a little look to see if there's any damage down below and I'll give you a clean up. That's lovely. Yep, no tears or anything. Fantastic. Bring your legs down and just bring you up. There we go. So have a quick look at this little boy, make sure everything's okay. Lovely, he's got all his fingers. All the toes he should have. Fantastic, just check his back. Lovely. Lovely inside his mouth, that's fantastic. Lovely, he's all happy there. Fantastic, congratulations.
Good morning everyone, thank you for coming. My name's Lynn and I'm part of the Children's Community Nursing team. This is India and she is a registered sick children's nurse, and this is Sharon and she is a health and development practitioner. And today we've got Jack, who you have just seen being born next door, and this is 10 years on, and this is Jack's mum. Okay, so as part of the Children's Community Nursing team, we see children in their homes, we sometimes see them in school, and we sometimes do clinics. Today, what's going to happen is India's going to visit Jack at home, because when he was born, he was quite normal, but since he was born, we've found out that he's got a muscle wasting disease. And what that means is that Jack can't swallow properly. So he's had an operation to put a gastrostomy button into his stomach so that we can feed him straight into the gastrostomy rather than having to swallow his food. So India's going to demonstrate to you today what she would do in the family home as a community nurse.
Right, okay. So obviously in the family home today, every time we visit a family in the home, especially on the first time, we'll always introduce ourselves and explain what services we offer. I've already met Jack's family before, so I've already gone through all of that. However, today is Jack's first gastrostomy button change. So all we would do when we're visiting a child is just reassure them, answer any questions they've got if they're anxious about anything. And then we'll just explain the procedure as we're doing it to them. I've got all of my equipment out ready, so what I'll do is normally go and wash my hands at the sink, and then get my gloves on ready to perform the procedure. Right, so Jack, we're just going to change your button today, and I know that it's your first time you've had it changed, but there's nothing to worry about. Okay? Yeah, it won't take a minute at all. So all we do, here it sits here in the tummy. This balloon would normally sit behind the skin wall, but obviously because it's a mannequin, we've not got that hole there to be able to insert it, so you can actually see where we're inflating and deflating. So we simply remove the water out of the balloon. Once we've removed that, that just enables us to take the button out of the body without it tugging or pulling at all. So we'll just remove that from there, Jack. Okay. And then we'll use some lubricant at the end of the new one, and that just softens it so it goes in really nicely, and we'll just insert it into the tummy where the hole is. I'm just going to secure it with it being a mannequin with a bit of tape. And then whilst we're holding it securely, otherwise it can just pop straight back out, we'll insert some water back into the balloon to make it secure. And once we've done that, we'll just give it a tiny tug just to check it's nice and secure, which it is, because we don't want it to be unsecure and fall out, otherwise it's going to have the procedure done again before it needs doing. So that's it, that's all the procedure done, and then we're going to hand over to Sharon, and she's going to perform the blood test that the GP's referred for. Okay.
Terry Jr. is now 19 years old. He has been struggling with his motivation and his parents have noticed he has been isolating himself. Terry has been referred to the Cypher mental health team. Cypher stands for Psychosis Service for Young People in Hull and East Riding. It is a mental health service for young people between the age of 14 to 35. A care coordinator and STR worker from the team have gone to visit Terry in his home. Care coordinators manage the care of clients. They develop a therapeutic relationship by meeting up with the clients and getting to know them. They find out what the client wants so they can support them in their recovery and educate them on mental health. STR stands for Support and Time Recovery. These workers delegate pieces of recovery work that the client has identified they would like to do. STRs are able to provide the time needed to support a client to do what is important to them in their recovery.
We're coming today because we've received a referral from the GP. We've come to meet you to see how things have been for you and if there's any support we're able to offer you. How does that sound?
Yeah, okay.
So before we start, did you want any of your family around us all?
They're not in at the moment, but in future I would like them.
It's important to check to see if TJ would like family involved in his care and also get consent to contact family should we need to.
So TJ, do you want to sort of tell us a little bit about what's been happening for you lately?
I've been finding it hard to do what I usually do. Things just feel different. It's like a dream world to me now.
Yeah, it must be difficult. Are you able to explain a little bit more about what's been feeling different for you then?
I think things have just changed and people are a bit different now.
It sounds really hard, yeah.
Yeah, it is. I can't do things anymore and my mood is really low.
What things would you say have been harder for you to do lately then?
Going out mainly. I've not been to football for ages and I've not been going out to see my friends.
Yeah, so when did you stop seeing your friends and going to football?
I think about a month ago.
So what about your friends and family? Have they noticed that you've stopped going out?
Yeah, they've noticed the change in me, that I've dropped out of football. I don't go out to see my friends and I spend most of my time in my room.
So can you remember why it is you stopped going to football and seeing your friends then?
I don't know. Well, I think people were talking about me.
Who was talking about you?
First it was my friends at football, but now it's everyone, like people on the street, I don't know. Sometimes even at home.
How did that make you feel?
Well, it made me feel angry and I got scared. But then it's confusing why all this is happening to me.
It sounds like things have been difficult for you. How did you know people were talking about you?
Well, I could see them look at me, talking and laughing, and I know they're talking about me.
Yeah. So what kind of things would people be saying about you?
Not very nice things. It's happening all the time. It's not just my friends. It's people on the street that I don't know. It's making it hard for me to go out.
There are lots of signs and symptoms of psychosis. Each person may experience it differently. Some of the early signs, such as what TJ has been experiencing, may include anxiety, depression, confusion, anger, feeling suspicious or paranoid. The scene today is highlighting TJ experiencing many of these early signs. 9 out of 10 people will experience thinking that someone is talking about them at some point in their life.
So do you think it's possible that people are talking about somebody else and not you?
No. Definitely they're talking about me. It's happening all the time, not just my friends.
TJ has been experiencing some unusual thoughts, such as other people talking and laughing about him. He truly believes this is happening and experiences this and also feels distressed by it. This might show that TJ is experiencing some of the symptoms and signs associated with psychosis.
So obviously things seem quite difficult for you at the moment, TJ. Do you remember how it all started? Or?
It's been like a month or two now since it started getting really bad.
So what was happening for you around that time? Can you remember?
Well, I just suddenly stopped going out and seeing those that were talking about me, and I've not been doing much lately. I've not been sleeping much. My dad is not well. That's making me a lot more stressed.
So what types of things have you been doing to try and manage the stress then?
Not much really. I've just been chilling at home.
Well, this is a question we'd ask everyone. It's not just you, but it's sort of to rule it out. Have you been using any drugs or alcohol at all?
I don't drink as much now because I don't go with my friends anymore. But I do smoke.
What is it that you smoke?
Well, normal cigarettes and sometimes a bit of cannabis. You know
How often do you say that you smoke cannabis?
I would say just a few times in a week, you know, when I'm stressed.
So how long have you used that for then?
A few years now I've used it. I just smoke it when I'm feeling stressed. It makes me better.
I'm not saying this to scare you or anything like that, but cannabis can actually affect your mental health state negatively and increase your risk of psychosis and other mental health conditions.
Cannabis has been linked to negatively affecting your mental and physical health state. It can affect how you feel about yourself and other people around you. At Cypher we would educate on the effects of and risks of drug and alcohol misuse.
Really? I feel like it helps me though. Although I've been very tired lately.
Yeah, it can affect your mental health in the short term and long term really. I know that you've mentioned not being able to do much as you used to. How's that been affecting your sleep?
I don't really sleep well, especially on the night. I can't sleep. But during the day sometimes I get bored and I fall asleep because I don't have much to do.
Sleep is really important to keeping yourself well physically and emotionally and for good mental health. TJ's not been sleeping much, which has affected his energy levels, mood and mental state. TJ has also stopped doing things he enjoys. This leaves him with lots of time to fill. Having a balance of daily activities and a good routine is important to keeping yourself well.
It sounds like you're having a difficulty with not knowing how to organise your time or not having a routine. Obviously this is going to affect your sleep.
Yeah, I just want to get back to how I used to be, you know, the old me, and do the stuff that I used to do.
I think as a team we may be able to support you in doing the things that are important for you. Maybe get your life back on track, provide education, maybe invite you to certain groups that we do, and obviously one-to-one support as well.
Oh yeah, that sounds good.
Okay, so we've got the theatre environment here, which is a simulation centre, which for us as registered practitioners is an amazing training unit for us. Obviously, as you can see, we've got a mannequin here, not a real patient, that we can work on. And we have a team of people here who are going to explain their roles in theatre. We've got Terry, who has come in for some surgery for palliative care for his terminal illness. And what we're going to focus on here is people explaining their roles and how many people it takes for safe surgery to happen with Terry. Okay, so we're going to start off with our anaesthetist, Dr. Darwick.
Hi, I'm the anaesthetist. I'm a specialist trained doctor, so I am a doctor. I anaesthetise Terry for this procedure with a mixture of drugs. Terry, under his operation, I'm looking after him. Looking after his clinical observations, making sure he's breathing. After his operation, when we wake him up, we look after his pain and pain management. So I spent 5 years at medical school, 8 years within this role in anaesthesia, and 1 more year I would become a consultant anaesthetist. And I couldn't do any of this without my operating department practitioner.
I'm an operating department practitioner, formerly known as an ODP in theatre. We practice as a registered professional, and after 3 years of university at degree level, the completion of that, we come into the role. It's a pretty exciting job, not varied every day, a lot of satisfaction with the job, but we mainly work as part of the team, but we can be asked to work on our own as well. Our aim is to make sure that patients like Terry actually get the best care that we do through theatre, and it's also in practice. But as an ODP, as I said, the role is very varied, so we can actually act as a recovery practitioner in the recovery room to help the patients come out on anaesthetics, but we can also scrub at the table as a scrub practitioner to assist the consultants and first assistant.
Hi, I'm the scrub practitioner. I'm a registered ODP, but my job can also be done by a registered nurse. Both the ODP and the registered nurse have to apply for this job after undertaking a 3-year degree course as a minimum. As a scrub practitioner, my responsibilities are to ensure that the equipment is sterile, just so that Terry doesn't have surgical infection. I also need to ensure that the equipment as well is all available to ensure Terry's procedure is done properly and the surgeon requires all the equipment. I also need in-depth knowledge of the procedure itself so that it preempts me of what the surgeon is going to require. To ensure that I keep my equipment accounted for at the beginning and right at the end, we do a surgical count, and usually to make sure that nothing is missing, I need some help from the theatre healthcare assistant.
Hi there, I'm a healthcare assistant, also known as a HCA in theatre. I was able to take this job after thinking that I might want to go into studying ODP, nursing or other healthcare positions. I don't have any experience or qualifications to go straight in to do the degree, so I looked for a job to gain that experience. I'm an integral part of the field theatre team and have many clinical tasks to perform throughout the day, including paperwork, which is documenting patients' details and also resourcing the equipment for the procedure. One of the most important responsibilities is the surgical count, making sure with the scrub practitioner that all the equipment is accounted for before and after the procedure. This is most important to the surgeon so nothing is left in the patient, Terry.
Hi, I'm Terry's consultant surgeon. My speciality is colorectal surgery and I will be performing the stoma formation to relieve Terry of some of the pain that he has been feeling. In order to become a skilled surgeon as I am, I've originally completed 5 years medical training, followed by 11 years in order to specialise in colorectal surgery. I'm obviously an important role within the team as performing intricate surgery, as I'm performing intricate surgery. However, I couldn't do any of this without my surgical first assistant.
Hi, I am the surgical first assistant. I'm a good trained as an RPP and that's for 12 years. I went on to do further training to enhance my clinical skills and knowledge to be able to assist the surgeon during surgical procedures. This could be a demanding role working alongside the surgeon, cutting sutures and retracting instruments so the surgeon can see what they need to perform the surgery. But we all have the same outlook and want the best for a patient like Terry here. I can work long and sometimes unsociable hours, but so does the rest of the team. However, we are all here because we care about helping people get better when they're ill and feeling vulnerable.
Hi, I'm Catherine, one of the Macmillan nurses, who's going to be looking after you at home.
I'm Terry. Nice to
Hi,
meet
Terry.
you.
Hi, Catherine, I'm Terry's wife, Kate.
Hi, Kate.
Hi.
So I've just come today to tell you a bit about my role. Obviously, we know your diagnosis. We want to care for you at home. I've just come to sort of say, we can help support you being at home. A lot of what we do is looking at your symptoms, but we also look at other things as well. Everything to do with sort of being cared for at home. Is there anything that's particularly bothering you today?
I'm getting a bit tired really of coming in and out of hospital.
Right.
Obviously I'd rather be at home with my wife and it's getting a bit much really.
I wanted him to stay at home as well, please.
And obviously you're not having any further treatment, you're not having any more chemotherapy or radiotherapy. So you're going in for things like being sick or having pain, or is it just sort of going in and out? Right, I'll say. So, but we can prescribe things for you. To remain at home, we need to put a box of medications in. Probably need to refer to a lot of different people as well, like the district nurses. Maybe need to get somebody to come and look to see if you need any equipment to help care for you at home.
Yeah.
Have you got any symptoms at the moment?
I get a lot of nausea after eating really, mainly directly after eating.
Are you taking anything for that?
No, nothing. Quite a lot of actual vomiting as well, which is...
So you're feeling sick, but you're vomiting after eating, are you?
Yeah, it's taken away my appetite and I'm losing quite a bit of weight.
He's not really eating anything.
Right. So I think we need to look at that. So I'll write you a prescription today for some anti-sickness medication. Sometimes it's a bit of trial and error. It might not work straight away, but if we give you a prescription, it's half an hour before food. Hopefully, it might stop you feeling quite so sick. I think a good thing to do would be to get the community dietitian to come and do an assessment. She can maybe give you some tips on putting a bit of weight on. I will make a referral to the district nurse as well, if that's okay. So if we put the box of drugs, the drugs are very basic. They're looking at pain, nausea, if you have some chest secretions and a bit of stress. So it's basic things. Obviously, if you can't swallow your medication or you're being sick, you know, we don't want you to feel in pain. So if we get the district nurse in as well, if you did ever need any of these injections, you would call for the district nurse. So we can look at doing that. How are you managing getting up the stairs and getting yourself washed and dressed?
I'm having to help you more and more.
Yeah,
really,
it's getting harder and harder really. As time goes on, it's sort of, yeah, it's getting harder.
I think we're both struggling a bit.
Yeah, I'm a bit conscious. I'm throwing quite a bit at my wife, and it's getting a bit.
It's tiring you out.
I can see it's tiring her, and it's a bit upsetting really.
So how do you feel about if we maybe got some carers in to help you get washed in the morning and maybe help bring you downstairs?
Yeah, all the help really.
Would you be happy with that?
Yeah, we'd accept that.
Yeah.
I mean, we do have a team of healthcare assistants that are part of our team, part of the end of life team, so we could send them into, you know, it would probably be the same group of people. So we'll look at doing that today as well.
Excellent.
What about at night time? Are you managing to get a good night's sleep?
I'm not sleeping at all, to be honest. I'm trying to make sure Terry's all right, and then I'm obviously seeing to him, helping him go to the toilet and stuff in the night, but then I can't get back to sleep because I'm stressing all the time.
Worrying.
Yeah, and I don't know what I can do.
Right, so what we can do is if you're in agreement, we can maybe put a night sitter in. Be somebody who they don't necessarily have to sit in the room with you. They can do if you want them to, but they can help you overnight, help you onto the loo. They can, you know, ring if a nurse is needed to come and give you some medication, and then you can get a really good night's sleep. But is there another reason why you're not sleeping? You're saying you're feeling a bit stressed.
I'm worried about money, to be honest.
Right.
Terry had to give his job up when he was first diagnosed, and then I managed to carry on working, but I've had to give mine up now. I'm caring for him full time. So we had a tiny bit of savings, but they're just going, they're just dwindling away, and I think I'm panicking. I don't know what.
And that's understandable, isn't it?
You know, how
so we can look at that as well. I think next time I come back, we'll obviously look at how your tablets are working, because we might need to tweak them a little bit. But I think what we'll do is that we'll do a benefits assessment, and we can send off. You are entitled to PIP. We can send off for that. We can assess you for a Macmillan grant, and we can assess you for a carer's payment as well. So these things, they're not going to replace being at work, but they can probably reduce some of the pressure a little bit. But there is help out there, and you're not getting the benefits you're entitled to, so we can sort that out relatively quickly.
Thank you.
So we've done quite a lot today. Obviously, I'm going to come back in 2 or 3 days because we need to check that you're managing all right with the medication, and obviously see if it's working. I will make the referrals to the district nurse and the dietitian, and to the carers and the night sitters.
Thank you.
And we'll come back and we'll look at the benefits, the financial side.
Great.
So maybe come back in 2 or 3 days' time.
That'd be lovely, thank you.
Because I think we've done quite a lot today.
Yeah, and I'll go get the script for the sickness.
Okay, well, nice to meet you, Terry.
Look for the opportunities. The NHS is a brilliant place to work. It's part of being a bigger team, and we all need the NHS. So to become part of the NHS is a really rewarding, valuable career, and everybody who works in the NHS has the patient at the centre. We're all here for patients, and that's what's important.
Going in and listening to the talks and talking to people has really helped us be able to look into our futures and see what we could do and the next steps we could take.